So at 1, we're here today at the San Bernardino County Fairgrounds. We have our public health here today. When I say the environmental health and public health, Corwin Porter, Melissa German, and I think what's so important here is that we get a moment for you to share how many tests you plan to do today and what do you see in the future for addressing this crisis.
Absolutely. So we're hoping to get close to 600 tests done today, but in all honesty, not everyone will meet the criteria. So it'll probably be a little bit less than that. And as the experience has shown by doing this last week, we'll probably have some no-shows. So we'll do as many as we can in the time allotted and with the supplies allotted. And then I'll let Melissa talk a little bit about what our plans may be for the future.
So this is our second one in the county, and so we're trying to get to all parts of the county so we can serve our communities throughout San Bernardino County. We will be going to the west end, the mountains, and also to the east side of the county. So we plan another one for next week in the west end, and we'll go from there. So, but as Corwin said, we will have some no-shows, so we are opening it up to drive-throughs starting at 1 o'clock, and it is based on the supply that we do have here today. So, but we do want to make sure we use as many specimen collection kits that we have today. So we decided to open it up at 1 o'clock for drive-throughs.
And I think it's important too, as we look at these in the future, and Corwin, if you can address what qualifies, or Melissa, a person for being tested. Because I think there's confusion that, hey, I want to test, I'm going to come receive a test. What qualifies a person to actually have a test?
Sure. So one of the main criteria we're looking for is you need to have symptoms. So that might be shortness of breath, fever, or a combination of all the above, some kind of respiratory symptom. And then we're looking at prioritizing folks who are a little bit older in our population. Generally, we consider those higher priority when they're over 65 years of age. They have underlying medical conditions, or if you're a first responder or a healthcare provider that may have some symptoms, we also prioritize those individuals, trying to get them tested so they can get back to work and keep protecting all of us. But so that's kind of the criteria we're using this morning. That when we schedule the appointments, those are the folks that got the priority and were able to be scheduled.
Well, I know looking in the future too, there's the plan to really expand testing as more and more tests become available. Can you address that in the future? Because I think it's important that we identify people who, one, have had it and have also recovered on their own. Is that something we'll be able to do in the future and look forward to?
Yeah, the department is planning to expand as quickly as we can. There is a national shortage really on the testing supplies that are out there. And so what we're trying to do is work with our private laboratories and even our own public health department with getting state supplies so we can try to turn these over as quickly as we can. And so the private labs are letting us know that when we deliver some, they'll give us more. So we're going to try to, get those turnovers so we can get our testing locations open and we can, get as many people tested as we can.
Well, I'm not going to take any more of your time. I realize that, one, we're getting ready to start testing in the process. So with that, we want to thank you both for all that you do. It means a great deal to all our constituents and citizens throughout the county, and we can't thank you enough for your team. Thank you again. Have a good day.
Thank you for being here.